Let's say you're having a hard time breathing through your nose, hard time sleeping at night, just overall something's going on with your nose. Let's take a look at this case. I have a feeling you're gonna relate. Let me tell you how I got involved with this case. Patient came to me because someone else told them I know a little about something called airway dentistry. They came into my office and I took a look at their airway. One of the first complaints I had was I cannot breathe through my nose very well during the day, during the night, and it's disrupting my life. So the first thing I do as an airway trained dentist, I do a 3D cone beam image of their head to look at their nasal restrictions. What I see over here is, right in this view, right over here, this is your eyeballs, this is your head, this is the sides, your top teeth, your lower teeth. These are the areas I'm gonna be looking at over here. And what I'm looking at here is someone's sinus that is so full of inflammation, it actually looks like an ocean. It almost looks like there's waves in there. And I'm like, oh my God, that would explain why this person has so much inflammation. They're having difficulty breathing is because you have an ocean of inflammation in there, mucus, and that's draining into the area over here, but it can't get out. If it can't get out, they're gonna always feel this fullness in their sinuses and they're not gonna be able to breathe. Now, my first question is, well, how did this all happen? Then I find out, I asked the patient, hey, do you know about this? They're like, oh, I just had sinus-plasty surgery done a month ago. I'm like, wait a minute, you've already seen an ENT doctor? They're like, yeah. Not only did they see this person once, this is the second surgery that they did on their sinus. They did a balloon sinuplasty, turbinate reduction, and septoplasty. That's basically all the surgeries you can get in your nasal system to open up the airway. It didn't work the first time. They did it a second time. It didn't work the second time. She's already scheduled to go for a third time. I was like, what in God's name? So I explained to the patient that the root cause of the problem is not being addressed. So they can do this 1,000 times. It'll never address the problem. The reason is they're not addressing the root cause of what's causing the restriction in the first place. The doctor's not asking that question, obviously, and the patient doesn't know. They can ask that question. Yes, 100% you can ask any doctor, what is the root cause of my problem? If they don't know, go find a doctor that does. In my case, I know what the root cause is. So in her case, I told her what it was. The reason why she's having restrictions in her airway is because she has an underdeveloped maxilla. The maxilla is the bone in the middle third of your face. It's too narrow this way, it's too narrow this way. If that system is getting squished, then all the little outflow tubes that allow for this mucus to get out, that's gonna get squished. It doesn't matter how much you rotor the inside, those little outflow tubes are too squeezed in. So what needs to be done, if I can wave a magic wand and I can actually expand the maxilla in this dimension, expand it in this dimension, that'll open all those outflow tubes to allow for all the drainage to get out. So that way she's not gonna have all this goop in there, and that'll actually open up the airway because it treats the root cause. You do it once and you're done. The second thing that I found when I did this imagery is I looked at another part of her airway. The airway is comprised of multiple areas. So in this case, your airway is just not your sinus and your nose and your turbinates. That's the top part. The other part of your airway is when air flows through your nasal system and goes behind your tongue and down into your lungs. She has a restriction right there. That is what's causing sleep-related breathing disorders at night. So when she falls asleep at night, she can't breathe through her nose, so then she has to breathe through her mouth. And then she begins to snore because it's so tight back here. That doctor never once addressed or asked, hey, well, where else is the problems at? They never once sent her for a sleep study, which I did. I go, hey, you got some other stuff going on in there. We need to take a look at it. Did a sleep study. What did that show? Mild to moderate sleep apnea. Now I have a medical diagnosis for sleep apnea. So her full restrictions was actually somewhere else. Do you see what I'm saying here? So in this case, what we need to do here is move the tongue this way. In order to do that, I need to have more room in the maxilla. It's too narrow. This is about 30 millimeters. The bare ass minimum, or the BAM as I like to say it, is 38. She's at under 30. So the maxilla is too squeezed in, which pushes the tongue backwards. So when she goes horizontal, when she sleeps, she chokes herself out. That's sleep apnea. So the underlying problem that is causing everything that's happening here is an underdeveloped maxilla. In her case, my proposed treatment for her was, there's two things you can do here. You can conservatively regrow the maxilla in some patients, or you get what's called maxillomandibular advancement surgery. That's where an oral surgeon takes your maxilla, moves it forward and wider, which then allows this area to be all opened up and opens up this area, which really gets all the birds with one stone. That would cure her of all of her issues. And that was what I recommended for her. So for you out there, I need you to find a doctor who looks for the root cause solutions. And that's how you're going to get the curative options that you deserve.